Good day everyone, I am Kaysinan Pelago, a student nurse from J.H. State College, Pagadian. Prior to perform the procedure, introduce yourself and verify the client's identity. Explain to the client what you are going to do and why it is necessary. So, good day ma'am, I am Kaysinan Pelago, your nurse for the day. May I know your name?
I am Jessie Lomuso.
How old are you ma'am?
I am 28 years old.
So, ma'am, I am going to assess your mouth to determine any abnormalities or any diseases. Is that okay with you, ma'am?
Okay.
And assessing your client or patient, we need to perform hand hygiene to eliminate the transmission of infection. And then we will provide for the client privacy. Inquire if the client has any history of the following: routine pattern of dental care, last visit to dentist, length of time or other lesions have been present, denture discomfort, medication client is receiving. So ma'am, how often do you visit a dentist for your dental care?
Twice a year.
Okay ma'am, when was your last visit to a dentist?
Last year before the lockdown.
Okay ma'am, are you experiencing toothache?
None.
Any medication that you are taking that concern this matter?
None.
Position the client comfortably, seated if possible. Inspect the outer lips for symmetry of contour, color and texture. Ask the client to purse the lips as if to whistle. Inspect and palpate inner lips. Apply clean gloves. Ask the client to relax the mouth and for visualization. Pull the lip outward and away from the tip. Grasp the lip on each side between the thumb and index finger. Note for color, moisture, texture, and presence of lashes. Inspect the teeth and gums while examining the inner lips and vocal mucosa. Ask the client to open the mouth using a tongue depressor. Retract the cheek. View the surface vocal mucosa from top to bottom and back to the front. A flashlight or pen light will help illuminate the surface. Repeat the procedure for the other side. For the examine of the back teeth, observe the number of teeth, tooth, color or fillings, dental check, dental caries, tartar along the base of the teeth. Note the presence and fit of partial or complete dentures. Inspect the gums around the molars. Observe for bleeding, color, retraction, edema, and lashes. Inspect extension ducts. Ma'am, can you open your mouth? Ask the client to relax the lips and bite down as though chewing or something, and note alignment of the lower and upper jaws. Then open the jaw. Inspect the dentures. Ask the client to remove complete or partial dentures. Inspect their condition, noting in particular broken or wound areas. Inspect and palpate the surface of the tank. Ask the client to protrude the tank. Note for position, color, moisture, size, and texture. Observe for fasciculation and check the midline protrusion. Palpate any lesion present for inauguration. Assess the ventral surface of the tank. Ask the client to touch the roof of the mouth and use a pen light to inspect the ventral surface of the tank, frenulum, and area under the tank. Note any induration. Inspect for Wharton ducts. Observe the sides of the tank. Use a square gauze pad to hold the client tank to each side. Palpate any lesions, ulcers, or nodules for induration. Check the strength of the tank. Place your fingers on the external surface of the client's cheek. Ask the client to press the tank tip against the inside of the cheek to resist pressure from your fingers. Repeat on the opposite side. Check the anterior tank ability to test. Place drop of sugar and salty water on the tip and sides of the tank with a tank depressor. Inspect the hard and soft palates and uvula. Ask the client to open mouth wide and tilt the head backward. Then depress tongue with the tongue depressor as necessary, and use the pen light for appropriate visualization while you use a pen light to look at the roof. Assess the uvula for position and mobility while examining the palates. To observe the uvula, ask the client to say "ah" and watch the uvula and self-palate move.
Ah.
Inspect tonsils. Use a tongue depressor to keep the mouth open wide. Inspect tonsils for color, size, and presence of exudate or lesions. Grade the tonsils. Inspect posterior pharyngeal wall. Press a tongue depressor against the tongue on the same side about halfway back while the client tilts the head back and open the mouth wide. Shine the pen light on the back of the throat. Observe the color of the throat and note any exudate or lesions. Remove and discard gloves and perform hand hygiene. Document findings in the client record using printed or electronic forms or checklists implemented by narrative notes when appropriate. So that's all for this morning, ma'am. I hope you have a good day. Goodbye, ma'am.
Goodbye.